Well, hello. Welcome
Hi.
back, everybody. This is Dr. Louise Ye-Liew. And have you been here in the Valley a year now, over a year?
Yep. Over a year now.
Very good. And you're a gerontologist. That's medically trained with an emphasis in us older people.
You're not there yet, Mark.
Oh, yeah, well, I wish. Um, Family medicine residency from USC,
Uh-huh.
but the thing I'm most interested in is you're a licensed acupuncturist.
That's
as
correct.
well.
Yep. I
And
did that right after
that is a different medical theory than what we're used to, I think, in this country, in the Western tradition of medicine. But in the Eastern countries, acupuncture is widely recognized and accepted.
That's right.
So here's my question before we get going. do those of us from the more Western tradition, do we find the same relief that those from the Eastern tradition find with acupuncture?
Oh yeah, for sure. So acupuncture is amazing. It's one of those alternative modality. It's not pain driven. It's not medication driven or anything like that. It really helps relieve a lot of different things. I have treated patients with hypertension, diabetes, arthritis, back pain, even just an acute muscle spasm, including Bell's palsy. You name it, I've probably already treated. I've induced labor with it. I've gotten patients pregnant with it and stuff. So acupuncture has been one of those amazing modality that is underused. And I'm excited that since I've now moved to Idaho, I've been practicing a lot of it with my patients, and they have seen such amazing results with it.
Well, that is totally awesome.
Yeah.
So we are trying to locate the other presenter, Gerald Boson. He hasn't logged on yet. I hope everything is okay, but we'll get him on here in a minute.
Perfect.
So this is day 2. This is the second session of day 2. And we've been talking about those coming years. Well, what we'd like to do is get people prepared for that. And you probably see from a medical standpoint or from a health standpoint, what those of us in the legal or financial profession also see, and that is, well, it's just going to work out. Whatever's going to happen, it's going to happen. It'll work out. It seems like there's a mindset for a number of years now that they'll take care of me. They're just going to take care of me.
Okay. Right.
And so I asked the question, so who's they?
Right. That's the first
Who
thing.
is it they that's going to take care of you? And what is it they're going to do to take care of you?
Right.
So Dr. Louise.
Yes.
Talk to us a little bit. There are some things that we tend to run into as we get older. I know the body doesn't last forever, but there are those things that we run into. And the question that I have is, can you talk to us a little bit about some of those things that we may be seeing? And is there something that we can be doing now to maybe slide that back, avoid it altogether, lessen some of the effects of aging? Can you give us an idea?
Yep. So one of the main things that when a patient comes to my office, you have to look at a person as a whole, from head to toe. we have to ask about the number of medications you're taking and why are you taking them? Because I can tell you probably over 50% of the population has no idea what these medications are for.
Oh my goodness.
That's a huge thing, right?
Yeah.
Because they could have been on it for years, not knowing why they're on a medications. And unfortunately, with a lot of medications, there comes with side effects. So side effects are huge. And a lot of times, a doctor will see the patient, they're on that medication, and they're going to say, you know what, I've only seen you one time, so I'm not going to make any changes to medication. But here's another medication to help
Yeah.
you with the side effect of that medication.
And those meds don't always coordinate well, right?
Correct. All the medications, we have to look at each individual medications and see how they are metabolized in the body. How are they, what are the mechanism of actions behind those medications, and how are they going to be broken down? And does that interact with any other medication? And that includes supplements too. The typical vitamins that we're taking or herbal supplements that we're given. There are interactions that people don't know about. Man, I feel really dizzy. I'm not sure why. Well, have we added any new things? No, doctors, no new medications. But what about, supplements? Oh yeah, you know what? I just started Valerian Root. Well, Valerian Root does cause people to feel like they're a little dizzy. It causes people to feel, it causes people to want to sleep a little bit more. And so those are just examples of interactions between just typical Western medications and things that are over the counter. And so that's a huge thing. When you go see a doctor, make sure your doctors are reviewing all your medications, including supplements. Anything in your cabinet that you're putting into your mouth is important for us to know so that we can determine whether or not it's safe to take together. That's number one. Number two, another thing that is always very important is when you do see specialists, which specialists are amazing. They're specialists for a reason. They've gotten extra training for these things, right? But it's important that the primary care physicians are the ones that are the core. They need to figure out what each specialist have done so that there's nothing going on. I've had patients come in and say, hey doc, my endocrinologist is increasing my insulin. And then my GI specialist says, oh, no, we can't increase the insulin. We got to decrease the insulin. So do you see how there's a little bit of imbalance? What should I do? So the most important thing is, as a primary care physician, we have to know who's saying what and what's going on with the patient, because they're so confused about what's going on. They want to do what they're told. They want to make sure that they're conforming to what the specialists are saying, but they're getting completely opposite recommendations. And so it's very important that the primary care physician is getting all the specialty notes, understanding what's going on, so that they can kind of figure out how are we going to puzzle these things together. Right.
So I've noticed at my young age, we accumulate, a handful of different medications.
Right.
I can imagine that those accumulate even more as you get older.
Will accumulate more as we get older, right? Because we don't remember to take them away.
Yeah. So there's two questions that I have about that. One is, I'm guessing that taking our medications the way that we're supposed to and staying on top of that is one way to help maybe prevent or alleviate some issues down the road.
Right.
The second thing is, are all of our family medical people able to look at that, or is that gerontology, focus, is it better to be there when we get to a certain age?
So ideally, as a patient becomes a bit more complicated, we're specially trained to really focus on the geriatrics population, the older population, because
okay, give us an age. What's an age? Give us a range.
Ideally 65 and above is the age range. But a lot of people are very healthy until they hit 70s, 80s. And so when they go to a whole new level in their health, that would be ideally just to have a gerontologist, a geriatric specialist kind of like on the side in case it gets a little bit more complicated, because we're trained in a different way. A lot of family medicine, internal medicine doctors have training with the geriatrics, but there are certain aspects of it that they may be missing, and that we may need to come in just for a consultation, not necessarily take over the care, just as a consultation. I think it would be a good idea just to say, hey, am I missing anything else? I am getting older. Is there anything else I can do to have the best quality of life as possible?
So even though people have generally good health, say they have it into their 80s, still at about 65, that's not a bad idea to go and see somebody with that geriatric training, because I noticed this morning I was doing my stretches. My wife was doing her stretches, and she goes, "We grown a lot, don't we?" Doing our stretches, and I'm going, yeah. So, I mean, I think there are some substantial changes too as we hit about that 65 age. So
Right.
worthwhile visiting with somebody in the geriatrics.
I definitely think so. I think it's always a good idea to have kind of like a cardiologist on board, so that, things that may be missed are covered as well. We definitely cover a lot more other things that may not be covered as in a quick, follow-up visit with your regular
Right.
doctor. My visit with my first patients are usually up to 1 whole hour. I just came out of an 1.5-hour visit with one of my new patients. We're reviewing everything that you can think of under the sun, and then it makes them think, oh, I have been on this a lot. I've been through a lot. What can I do to change it? And so we talk about goals for their health. We talk about, who we need to stay with, which specialists we need to stay with, so that they don't feel overwhelmed. A lot of times as they get older, they feel overwhelmed. I have to see all of these specialists. I can't keep up with everybody. So then we kind of go over which ones are more important, and the other ones maybe just once a year rather than once a month. And so it makes them feel less overwhelmed.
Okay, so I've heard two things so far, and I want to follow the next step. Two things I've heard.
Yeah.
First of all, whether it's with you or another gerontologist, if they have a doc and they've been following, they're doing their annual visits,
Right.
do that. Keep doing that.
Yep.
Review those medications, and don't just stop taking them.
Right. Don't just stop taking medication just because Dr. Ye said, oh my gosh, all these medications are bad. Don't ever just stop medication.
No, not
You have to talk to your doctor.
Yeah. And so the third thing, then the next step for me is visit with you or with a gerontologist, get this organized, maintain your meds. There's a reason that you have the meds.
Right.
What about some other things that we could be doing to help maintain our health and get us going towards our goals?
Definitely need to do is get out of the chair, right? We need to start moving our body. People who have arthritis, a lot of times they feel like I'm too achy to want to move. But the irony of it is the more you don't move, the more achy you become.
Yeah.
So you got to do everything possible to exercise, even if it's 5 minutes, 10 minutes. I tell my patients all the time, that's going to make a big difference, right? And then we talk about food. What are we putting into our mouth? What are we actually doing to keep our body healthy? Oh, I'm so stressed, so I decided I'm going to eat a whole tub of ice cream. Well, I'm not going to say that's not
just a
small, but maybe like this, a little bit bigger like this. But those are all important things that, just like medications, what we put in our mouth, food-wise, same thing. It's going to be important. But another big thing is not just that part of your body. We also have to think about how do we have a discussion with our family about how we keep our body healthy. That's going to be huge, right? So a lot of times as we age, as our health declines, then we're in a rush of, oh my goodness, I got to now figure out what I want for my future.
We're going to catch up.
Right. So instead of catching up, let's have started the conversation before that happens. So big thing, and especially this is where you come in board, is advanced directives, right? The estate planning out what is going to happen to us if my health declines.
Right.
Because eventually, just like you said, we all go one way. We're all, we're not immortal right now, eventually maybe, but those are all going to be important conversations to have with your loved ones, whether it's your husband, your kids, whomever. It's important. So yes, keep the exercising, keep the, healthy diet, have the medication be reviewed, like do your annual exam with your physician, but you need to talk about the future. It's a little scary discussion, but as you have more and more discussion, it's not going to be as scary, because then when things happen, it's not going to be, okay, what did my mom want?
Yeah.
What should I do now? Right? It's something going to be, let's honor their decision on what they want to be done. Let's honor my decision on what I wanted to have it done in case something happens.
I mentioned yesterday, we were visiting in a very similar conversation, but it was about long-term care, what of our choices. If we were to do a conservatorship, the thing that, this is a legal determination of whether or not you're competent. And the judge, and the kids always do this, well, dad's making poor choices. He's doing this, he's doing that. They're all poor choices, and that's enough. They go to the judge. The judge doesn't care if I'm making poor choices.
Right.
If I have the ability to make good choices.
Right.
And so if he finds out I can make good decisions, then he can make any decision he wants. He's competent, let him go.
Right.
So I bring that back to that conversation with the family, whether it's with a spouse, a significant other, whether it's with the kids or who your group is to understand what dad wants, because maybe I'm doing it my way. Because dads are never like that, right? They're never stubborn.
No.
That never happens. And so I've seen it where the kids are kind of waiting for dad to not be competent so they can make those decisions for him, because he's making poor choices.
Right.
Well, and so that leads me to this question, because you said have that conversation with your group, whoever your support group is. Mm-hmm. I think that's important for two reasons, at least my experience with that. There's two reasons. One, the reason that you stated is I want them to understand who I am, what I like, what it is that I want to have. But two, that connection with a support group is huge.
Right.
Really huge. We talked a little bit about hospice yesterday. And one of the things that so many folks in the hospice side of life try to do is help parents reconnect with kids, trying to not leave some undone business.
Right.
And by golly, what you're saying is we don't have to wait till we're on our deathbed.
No, let's not wait. Yes, let's not wait till the end, right? Let's not wait till we're in an emergency situation.
Okay, so talk to us then a little bit about stress, because there's this thing going on right now that's isolated a lot of people. They don't get the touch. I get to visit with my mom on the phone, and then when I'm down in Utah, I get to go visit with her through a glass window.
Yeah.
She is craving touch. She wants to touch her loved ones. She wants the hugs.
Right.
She wants her little ones to come up and get on her knees. I mean, she's craving that. So talk to us a little bit about stress and some things maybe we can be doing to keep that well, and what are the effects of stress?
Well, stress is going to be huge, especially in the geriatrics population right now. Isolation causes depression. Depression causes pseudodementia. Pseudodementia
Oh,
meaning that they don't necessarily have the actual Alzheimer's or the Lewy body or the frontal temporal dementia. Pseudodementia means that they're so depressed in their life that they end up having some memory loss that people will start noticing. And a lot of times, especially if we're far away, we may miss it and say, why is mom or dad so confused?
yeah.
And it's just because of the isolation. So big things that I highly recommend is constantly trying your best to get somebody to help them FaceTime their loved ones, talk to them on the phone as much as possible, send them care packages, and just, remind them of when this is all over, things are gonna get better. And it's unfortunate, and I know assisted livings and independent livings are doing their best possible to try to minimize exposure to the residents,
Yeah.
but at the same time, even through that window and touching the window with each other's palm makes a big difference, because that feels like you're there. So even though, yes, they're not available to be full on, think about teddy bears, think about even a regular baby dolls. A lot of dementia patients or memory loss patients do love that, the feel of a like a doll or a teddy bear, just so that they can squeeze it. And by doing that, it's kind of like Pavlov, right? It's like the where the dog, would run to where the food is and stuff like that. Or back in the day that the monkey got the ragged doll versus
Right.
the, right? So same thing, just having that feel of it is going to make them feel so much better. And that can help lessen a little bit of the depression. I'm not saying it's going to take it away, but it will definitely help lessen it a little bit.
So talk to me then about those of us that maybe are feeling a little bit isolation and depression, even though we're not, being quarantined. Exercise help with this?
Exercise
Are there
is
some other
huge.
things we can do?
The vitamin D through the UV light outside is going to make a difference. It's going to help, it's going to help our energy. It's going to help bring out the ATPs that we learn in biochemistry, right? It's going to bring all of that out and make us feel better. It's going to bring us the endorphins that we need. Just a simple things by going for a walk outside and getting the sunshine on our body is going to make us feel better. So if your loved ones are stuck in assisted living and you're out there walking, and FaceTime them as you're walking and say, look, mom, look at all the beautiful leaves, and show it to them. That's going to make a difference too for both you and your loved ones.
Very nice. Very good. And I, my wife and I have a yellow dog, Maisie, who's
Uh-huh.
who's 10 now, 11. Ooh. So she's getting a little older. And it's funny because when we get up in the morning, if we get up a little late, she's out whining
Right.
and jumping. She's ready to go for a walk.
Right.
We open that door, she's just all over doing everything. We get that clicked on. And as long as we're walking away from the house, she still has all this energy.
Right.
But when we turn and come back to the
She
house,
mopes in.
it slows down.
Yeah. She
So,
knows.
yeah. So, and I've got the little Fitbit here thing that says, oh, you need to walk so fast and you got to do this. And what you're
Right.
saying is, hey, go with the dog, let it go. If we're
Sure.
slower, we're slower. It doesn't matter.
It's okay. I mean, take your time. If it takes you like a normal 10-minute walk takes you 20 minutes, that's great. Anything to
Just
move
get
your
out.
body.
Yeah. And breathe. I imagine breathing helps immensely.
Definitely. I mean, they have like simple YouTubes on how to do simple yoga or geriatrics yoga or geriatrics meditation, any of those. Take the phone. I mean, we all have cell phones, right? Take it outside and go do a simple meditation outside. for 5 minutes, 2 minutes, anything to breathe in the sunshine and the fresh air and everything.
So my wife likes to garden. She's
Mhm.
always had some flowers around, but
Love it,
she's taken over the vegetable garden
right?
and gets her out of the house. She goes out, she does it. When we get home from a trip, the first thing is to go see how those vegetables are doing. So gardening, I imagine, is huge.
Huge, especially around this area. It's a perfect time. It's a perfect season to do everything.
Yeah.
And even if you don't have a garden, I'm sure your neighbors have gardens that they're more than
Yes, they
happy
do.
to allow you to help.
Yeah, I said if anybody needs zucchini, I might know where you can get some. Also, if you need to get out, you can come mow my lawn too, because I have a
I'm good.
mower.
I'm good. I have my own lawn to mow, and I got my own kids to just let them run around like a nutcase.
So I have a couple of other thoughts that I kind of wanted to bounce off of you. What if we have a parent that doesn't want to come visit the doctor?
so if
What if
there's
we're in
there's
one of those situations?
so if that's the situation, there are people that will come to the home. For example, I do go out once a week to go see patients in their home in the facility. Um, and usually we're one-stop shop. We try to do blood work, we give the vaccinations, we try to do everything we can possibly so that if we do get kicked out later on, we have pretty much everything done
Got what you need.
in one sitting. So there are companies out there that will do home visits that will help and do everything possible. And if they can't get out or they don't want to get out, it might be a good idea just to have a doctor come in, do an assessment, make sure everyone is healthy, and then you have to worry about it for another 6 months.
Now, do you do the virtual visits with like the Zoom like we're doing right now? Are you able to do that?
I do that as well. I do telemedicine. It just depends on the patient population. There are certain 80-year-olds and 90-year-olds that do the Zoom better than my mom or me, actually, me. But then there are quite a few that are not great with technology. And
Got it.
so when they're not great with technology, we try to ask the family members to be involved or the assisted livings to be involved so that we can see them face to face. And if that doesn't work out, then we definitely try to come out to the patient population, and we are masked and clean and everything before we go into anybody's homes or facilities.
Well, and I imagine they're still in this day of all these great advances,
Yeah.
you still gotta touch them. You gotta get their, you gotta get the stethoscope on them and check the blood pressure and look in the throat and the ears. And so still have to do that,
For sure.
but the follow-ups in that can be telemedicine.
Correct. The follow-ups can be through telephone or it could be through telemedicine, depending on what they're capable of doing. So a lot of times when it's follow-up visits, it's usually over the phone for a majority of my older population, just to say, hey, FYI, let's get you off of these medications, right? Because I've reviewed everything. I literally go through the cabinets and pull out every medication and see which ones they've been taking. And then I can tell them, let's stop these. Or you know what? We need to continue on with this one, but let's try to make it our goal to discontinue. So definitely a lot of it can be through telephone and telemedicine.
Okay, so now, what if they just don't want to see a doctor? It's
If
not a
they don't,
matter of getting out, it's just they don't want to talk to Dr. Ye.
right. So a lot of times if that happens, I mean, we're going to have to respect their wishes. We're not ever going to push through anybody's door and say, you have to see us, right? So the most important is just if they need to have a little commencing, they may want to just interview me or a PCP over the phone. Well, what can you do for me? A lot of times, if we're able to explain to them why the purpose of the visit is, majority of them are going to be more accepting. If not, then the best thing to do is still have the conversation with your loved ones, especially the family members. Have the conversation with your loved ones. Well, if you don't want to see a doctor, can you let me know if so-and-so, if A, B, and C happens, what would you like? Right? This is where the estate planning happens again.
Yeah.
We have to have that conversation. They may not want to see doctors, and that's okay. We respect our wishes. But mom, if this happens to you, what would you like to have done?
So talk to us a little bit about, I was just in the previous session talking a little bit about Medicaid versus Medicare. Turn 65, that's the only requirement for Medicare.
Yep.
How much of the cost to say, have you come and visit or anything like that, how much of that is covered by Medicare?
Majority of it is covered. There may be, depending on if it's supplemental coverage or HMO coverage, majority of the visit is covered by insurance. There's a very rare moment when somebody gets a bill, and that could be because we have the wrong insurance cards, since a lot of times the insurance gives you a whole new number, just like how Medicare changed from Social Security to a whole different number, and mom and dad never got the new cards. So usually that's pretty easy to be fixed, because our billers, St. Luke's, St. Al's billers are just going to call the insurance up and say, hey, can we remediate this? And usually it's all fixed up.
So in addition to having a power of attorney for healthcare and a HIPAA release so that the kids can maybe talk to you as well, it would be good for the kids, if they're helping mom or dad, to look through their insurance stuff and make sure that it's current, and that then they could help you to figure out what's going on. Right.
And again, it's not anything, you don't have to dig through anybody's drawers or anything like that. If they can't find it, somehow, some way, we'll figure out the insurance information. So it's not 100% essential. It just makes it a little bit easier, so you don't end up getting a heart attack with a bill, right, that says this is not covered service. It's just going to make it a little bit easier, smoother transition to be able to utilize us to come to the home.
Well, yeah. So a minute ago, we were trying to reduce stress.
Let's not introduce stress, right? Because you get a huge bill or something that says, wow, why didn't insurance cover this?
So let's take a situation where we're dropping in to see mom on an ongoing basis, maybe at least once a week, maybe a couple times a week. What are some things that we could kind of be looking for with her that would kind of raise a red flag that we should maybe call you and get something going?
So things that we worry about is skin breakdown. As we get older, our skin tends to be kind of like paper. You just bump it and you get a bruise, you get a skin tear, right? Other things are, mom seems a little bit more confused than usual. Things that she usually can do off the bat, no problem. A little bit more confused. What's going on, mom? Right? Agitation is a huge thing. Are they more agitated than usual? Mom used to never hurt a fly, and now she's cursing like a sailor. Something's going on, right? Because a lot of times when they have a bladder infection, pneumonia, something going on in their body, they can't verbally tell you what's going on. So those are the times when you definitely need to call a physician or call a nurse practitioner and say, hey, help me. There's something going on with mom. I can't explain it. And a lot of times family have intuition and they can feel that something's going on, right? Mom was driving the same routine every Monday, and bam, I can't find her for 2 hours. She calls me later and says, I don't know where I'm at. That obviously is the biggest red flag that we need to think about.
Yeah. Interestingly, with my mother-in-law, perhaps because I was the outlaw, they used to joke, you're the outlaw, not the in-law. But I noticed some things going on with her memory that I don't know that any of her kids picked up on. And as
Right.
I discussed it with my wife, she was going, "Oh, mom," and da da da. And I was like, there's a little bit going on here, and we were able to see, I think I was picking up on it. She had some real memory issues, but
Mhm.
she masked it really well. And two, the family was in complete denial.
Right.
So what are some things we could do about that? That denial is strong.
Denials is really strong. I mean, just let them know the worst case scenario is take her to a doctor and a doctor diagnoses them, right? Have the physician work them up. There could be an underlying cause behind it. Like I said before,
Yeah,
UTI, pneumonia, those are all simple things. Or dehydration,
yeah.
huge in the geriatrics population. We're all guilty, including myself, of not drinking enough water, right? Because we are so busy with our lives and we don't think about it, or we're afraid to go have to use a restroom all the time. So just simple things like that.
Wait till you're my age.
Hey, hey, I get it. Trust me, I
That's
got two
how I
kids.
set my alarm clock
Based
at
on
night. Yeah, I catch up on the water that I didn't drink during the day.
that.
Oh my God.
So, but so if the family's in denial, you just have to explain that, hey, the worst case scenario is you take the patient to the physician, and the physician says, you know what? No, there's nothing going on. I mean, a physician should be working them up definitely with blood work, questionnaires, just a full physical examination, and making sure that they're not missing anything. When you have a smaller intuition that something is wrong, don't hesitate. That's the reason why we went through all of our training the way we went through, right? We want to figure out what's going on. We may not be able to solve the case right then and there, but at least it gives us a chance to start thinking about what are things that are possibly the problem at that time.
Got it. So one of the things that family should do is not tell you everything.
No, please don't do that. Don't give me bits and pieces. That's the worst that you can do for a physician, because a lot of us, we're trying to put a story together. We're trying to do our best to give them the best quality of life. So we really want to know what's been happening. I mean, I've found patients with memory loss because of concussions that they've had in
Oh
high school.
my.
They've had severe head trauma due to a car accident 20 or 30 years ago. Right now, I have a patient that I'm working up because he's been inhaling paint since he was
Oh my
13 years
goodness.
old, and now he's 50 something years old and having memory loss. So I'm working all these different things up. So little things that you may not think is important is extremely important for me, because then I know, for paint, I gotta look for metals, right? Especially back in the day when
Yeah.
they're 13, 14 years old, there's no safety. They don't wear a mask, they don't wear anything. How much did they inhale in it?
How much
So
lead? How much lead did they ingest?
exactly, right? And so after you have, and remember as a kid, I remember my son getting lead blood test before he hit 1 years old, just to make sure he doesn't get it. And he, gets end up getting like encephalopathy or something. So as a physician, please let us know what's going on. We may not ask the questions fully. We try to do a more open-ended question, right? But if we need to open a Pandora box, we rather have that than say, why are they having all these altered mental status going on?
Yeah.
So
And so they should probably push a little bit. I'm not saying they should abuse you, but they should maybe push a little bit and give you
right.
everything.
Right. Give us more information. I mean, more information is always better and more helpful. So then I can really figure out, I can be the CSI essentially in
Yes.
real life, right?
Yeah.
And try to figure out what is reversible. I mean, unfortunately, there are things that are not reversible, like Alzheimer's, where the brain shrinks. I can't reverse that. But if patient has something called vascular dementia, which is essentially memory loss due to a vascular condition such as high blood pressure, diabetes, high cholesterol, all of that, I can at least slow it down, because then I can say, you know what? if I can get your blood pressure controlled, if I can get your A1C
Right.
down from your diabetes, I can slow down your memory loss. That's going to be a huge thing for me, you know?
Yeah.
So those are all definitely important for me. You come in and say, hey, mom has been taking medications every single day. Are you sure? Or are you assuming? That makes a difference.
Yeah, we had Dee Childers on yesterday, and
Love her.
she mentioned that one of her first clients in working as the care manager was a nurse
Mhm.
that had not been taking her her insulin for 6 months.
Boy, they.
Yeah, so when they come to you and say, Mom's been taking her meds, well, how
I'll
do you
find
know
out.
mom? Yeah, how do you know that mom was taking her meds? Well, she told me.
Yeah.
Well, if she's having some memory issues, or she doesn't like the meds, or there's a
Right.
number of reasons. Yeah.
Well, I'll find out. I mean, like eventually blood panels and a lot of things will let me know. It kind of lets me in on a secret a little bit, right? And so those are all, we'll eventually find out. We'll eventually figure it out. I mean, the most important thing is, hey, go into the cabinet and see if mom has refilled medications
Yes.
recently. Pharmacy now calls us and says, and gives us letters that says your patient has been non-compliant also. So then we make a beautiful courtesy call to
Yep.
the family and say, hey, what's going on with this? Right? So that makes a big difference.
Okay, so agitation, maybe some confusion,
Mhm.
change in routine,
Yep. Weight loss.
weight loss,
Mhm.
skin, you
Those-
mentioned the skin. Anything else that we just, as we're there, we should maybe pay attention to?
Just looking at the environment itself, right? If the place used to be meticulously clean and all of a sudden you see all these boxes or things in the way, those are all going to be signs. If you have rotting food in the refrigerator,
Yeah.
even though your mom makes complete sense, those are all going to tell me different things.
Got it.
So checking the environment that the person is in is going to be huge for a physician and the loved ones as well.
Okay. Is there anything other than they've collapsed on the floor and are completely non-responsive?
Oh
Is there
dear.
anything else that says, geez, we ought to be maybe dialing 911?
I mean, really, the most important thing is use your intuition. There's something going on, right?
Yeah.
There's something going on that we cannot explain, and it needs to be pursued. Call your regular doctor first. A lot of times we can take the patient on the
Got it.
same day and try to get through everything before it gets to the point of the emergency. Unless, of course, they're collapsed on the floor, they have no heart rate, they have no, right? But if it's something that seems like it's more acute, we as a primary care physician can do our best to try to figure out, because a lot of us already know our patients so well
Right.
that we can kind of see there's a little change here and there, and we can see what we need to help to,
Got
to
it.
care for them.
So we got a couple of questions from folks that are tuned in. One is, do we need a referral from our doc to come see you or a gerontologist?
No, not majority of them do not. Once in a while, if let's just say the patient seems to be declining more, I do love reading the previous physician's notes to see where the decline is. It helps me, it guides me to see what has been done already, so I don't have to start from scratch. Just like a specialist, right? We don't, like as a cardiologist, we wouldn't want to say, oh, you're here because, oh, I've had so and so and so, but my primary care has already done an EKG on me, has already done this for me.
Yeah.
If I have a little nice, beautiful summary that as much as possible, it helps guide me to say, okay, you know what, let's start from here and let's keep going, versus now I got to start from the scratch. I got to see what hasn't been done,
Got it.
So no, you don't need a referral, but if I can get some records, that would make my life a lot easier.
All right. Another one, and I've seen this a bit, sciatica. I'm sure you've had some success with acupuncture and sciatica.
Acupuncture and osteopathic manipulation helps a lot. Stretching, physical therapy can help. Occasionally, a steroid injection can help, but you have to talk to your regular doctor to make sure that, to discuss all the side effects and what's potential, right? So.
All right. So we're running out of time. What's the best way to get hold of you?
So if anybody would like to talk to me, my office number is 208-509-8987. I'm located in Meridian. My address is 1524 West Cayuse, Cayuse Creek. And that is right next to Rocky Mountain High School. We're right in the middle of Rocky Mountain High School, and we're the new Linder, or I think now it's called Orchard Hill or something, village. Where the new Winko and everything's going to be opening up off of Chinden and Linder. So that's where we're located at.
All right, very good. And again, don't need a referral over to you. They can pick up the phone. They can call you.
Pick up the phone and let me know what you need for anything. My staff will do our best to help out when we if you guys give us the release of records, then we can request it from your primary care physician before the visit as well to see, what we need to do.
Excelente. Thank you for your time, Dr. Louise. It's always good to see you. And have a lovely day.
You too.
And keep us out of trouble.
Do my best.
All right. Thanks.
All right. Thank you, guys.